This was the second year that the Partnership in Caring went to Rwanda. Now, how was this year different from, say, last year?
Last year when we traveled to Rwanda, it was in many ways a fact-finding mission. We did have areas to focus on, such as mental health, surgery, and palliative care. But this year we went with a more focused agenda. That included palliative care, maternal child, and burn. And that was because the people who volunteered had specialties in that particular area, and it generally matched the needs of the hospital in Butare, Rwanda, where we spent our time.
Now, the team you had this year was a bit different too, wasn't it?
Yes, last year the team was essentially from Antigonish. The group who volunteer are healthcare workers. Last year we were all from Antigonish. This year we had 3 join us from Cape Breton: Dr. Anne Frances Dentino, who's a palliative care doctor, Kim Popwell, a social worker in palliative care, and Dale Orchuk, who's a retired nurse but specializes in palliative care. Also, we had Kim Grant, who works out of IWK as a neonatal nurse, and Kathleen Connell from Canmore, Alberta, who is a St. FX graduate and has been to Rwanda in the past, joined us, and she is also a neonatal nurse. And then we had Bryn Aquinagua, who's a burn specialist, and she's also been to Rwanda in previous years with the St. FX nursing students.
So we mentioned the other members of the team that were part of a partnership of caring from outside of this area. But what about the local team members? Who were they?
Yes, we had Dr. Carolyn Rideout, who's a psychiatrist, as well as she works in palliative care. Lynn McDonald, who's a palliative care nurse consultant. Janelle McKay, who's a wonderful musician, wonderful musician. And myself, Maria, I'm a mental health nurse.
Some of the programs that you did in the hospital were really very special, weren't they?
Yes. Thanks to Kathleen and Kim, the 2 neonatal nurses, we were able to provide education and support, a train-the-trainer model on helping babies breathe. It's an exceptionally good fit for what we needed at CHUB in Butare. The first 3 weeks that we were there, over 20 babies died at birth and shortly after birth. The training that Kim and Kathleen brought around helping babies breathe focuses on that first golden minute of life. So they spent 2 days training up to 30 participants around this helping babies breathe. It was immediate, the effect. The nurses felt so empowered, and they were able to practice those skills immediately on the floors, and they were keeping babies alive, and they just felt so empowered by all of that. And we were so proud to be able to bring that program. And in fact, the program has been so successful that the hospital at CHUB has asked that we continue offering the training. So we're going to be providing some funding for at least probably up to 45 more people will be trained within the next few months at the hospital. So we're pretty excited about that. I'm pretty proud that we were able to support that very worthwhile initiative.
One thing you did that was a little different this year as well is that you went to Uganda, to Hospice Africa Uganda, and tell us a bit about that, because that was part and parcel of this piece about palliative care, right?
That's absolutely right. We decided that it would be very worthwhile for us to spend time with the Hospice Africa Uganda program. Dr. Anne Merriman is a doctor from the UK who's been working in Africa and has been a leader in bringing palliative care programs to places in Africa. She is based out of Uganda, in Kampala, in fact. So we had been in touch with them prior to our traveling there and asked if we could spend some time. And in fact, there was 4 of us, the 3 from Cape Breton and myself, who were able to spend 4 days learning about their program. It was an amazing experience, learning about the palliative care practices, the pain management control, the holistic approach that they have around death and dying. It was quite heartwarming to see, despite the abject poverty that we were exposed to as well. Kampala has quite a slum area. There's over 2.2 million people who live in the slums. So we were out there working in the slums and in some of the local hospitals as well, with children who are in palliative care and adults who are in palliative care. The average lifespan for a person in Uganda is about age 52, and we were seeing some very, very sick women and men in their 30s and 40s. We saw a young boy he was probably a year and a half old, who's dying as well, and we were able to follow the team that works out of Hospice Africa Uganda and watch how they were able to provide support to the family, to the hospital where this young boy was in particular, and to the community.
Maybe to get an appreciation for people who are listening to this of the conditions that you were facing. Maybe you could describe to us what it was like to be in the University Hospital in Butare.
CHUB, the University Hospital in Butare, is a 500-bed hospital that services over 2.2 million people. People come there from district hospitals or from community health centers, and they're usually very, very sick. The hospital has many of the units that we would typically see in a hospital: medical, surgical, pediatric, ICU, physio departments, etc. And there are many challenges in the hospital. The most striking for us is that the hospital does not have any running water. So it's really hard to practice good infection control without good hand washing. So there are gloves are available, and there are the hand washing liquids available, but no soap and running water. So it makes it very difficult to care for people, for patients. The other really big challenge there is that there's no food provided for the patients. So families have to come, if they have a loved one in hospital, and provide basic care and cook for their loved ones. That makes it very difficult. So surrounding the hospital, you'll see families coming and tenting and staying and doing their wash there, doing their families, the patients' wash, cooking meals on open pit fires, and bringing the meals to families. If a person doesn't have a family or family member who's able to come with them, for example, if they come from quite a distance away, they're often alone and are not able to get food. So one of the things that we were working on this year was establishing some support to the social work department there. So we were able to spend a fair bit of time with the social workers, getting a sense of what the needs were, and then providing some funding to buy simple things like rice, sugar, cereal, milk, and some personal care like lotions and soaps for persons who are in hospital who do not have family members or loved ones to care for them.
One thing that this group has always been struck by is the enormous generosity by people in this community, and I know there's several projects that you were able to do because of them, and maybe I'll just go through one of them at a time. One was certainly a connection that the Anglican Church in Antigonish made with their counterparts in Butare, and that was probably particularly special.
It was indeed. The St. Paul's Anglican Church in Antigonish started a project that was dubbed by us as the Holy Goats Project, where they raised some money. We were able to bring it to Rwanda, to the Anglican Church in Butare, which is in fact the bishop's church. The bishop's wife, Florence, is a nurse. She's a midwife, and she was able to, with that money, buy goats for a group of widows who live in a very poor community just south of Butare. That was really special. We were able to actually meet with the women, They actually had walked 2 hours to see us, to thank us for bringing the money that bought the goats for them. These goats are especially important to women. They help provide money for the women, small amounts of money, not huge amounts, small amounts of money. The women will breed the goats, sell or move the baby goats along. So we're really happy to be able to facilitate that, and we certainly are so pleased with the generosity of the Anglican Church here in Antigonish, and we will continue that relationship with the Anglican Church in Butare when we return next year. So the bishop and his wife have great plans for their church and their community, and in a small way, we hope that we can continue to support them.
Another one was, this was particularly special because this was just before you left for Rwanda, where Sister Lillian Gadet at Bethany, who's a voice teacher for local students here, and they donated some money, which was put to good use. But there's quite a story to this before you left, and maybe we can kind of walk through what that was, because it was particularly special.
Yes. Sister Lillian Gadet is a music instructor, and she had a group of students, ages 9 to 15, who have been with her, and she's been teaching and instructing them. Before we went to Rwanda, they had an opportunity to compete in a music festival, and Sister Lillian spoke to the children and asked if they might reconsider that. Instead of competing, that they might provide a concert in Antigonish at Bethany, where they would raise some funds to bring to the more vulnerable children in Rwanda. So the message to the children is so amazing, because instead of being competitive and competing with one another, they were sharing that universal gift of music with not only themselves, with their community, but with a community in Rwanda. And in fact, that particular funding went to a very special group of sisters, the Benebikari sisters, who live north of Rwanda, or north of Butare in Rwanda, in a lovely farm where they hire the local families to help with the farming. They have provided schooling for young children, so they're getting, these are areas that are driven by poverty. It's they have no electricity. There's very little food, so they're getting children off the streets into schools, and it's so heartwarming. We were lucky enough to spend a fair bit of time with Sister Augusta, who runs the schooling part of the farm and the convent, and so to bring that money to her meant that children can go to school, and children can be fed, and that's so important. And we trust that they'll be great stewards of the money that we brought to them. And we were, in fact, met two of the young children that would be sponsored to go to school. They were wandering around the property, and they're school age and not being funded to go to school. So right away we were able to see the benefit of the generous donation made by Sister Lillian and her music students.
Another thing you had was that you took over with you was you brought teddy bears over to Rwanda, and so tell us about how that came about and where the teddy bears ended up.
I have a good friend who runs a company called Jockey Clothing, and they have a teddy bear, a jockey bear, that they sell. So the teddy bears are cost normally about $10. So last year, during the month of November, there was a special promotion on that. If the bears were sold, any bears that were sold, 100% of the money would stay in Canada for post-adoption services. And we decided that if we were able to get people just to buy the bears, that certainly the money would stay here for post-adoption services. But the bears would go to Rwanda. So in fact, with the help of a local 4-H group in St. Andrews and with some other private donors, we were able to buy 100 bears, and I stuffed them all into a big hockey bag, and off they went. Came to Rwanda with me. They were quite the hit. They went to a really special place as well. It's called PREFER. It's Poverty Reduction, Education, and Family Empowerment in Rwanda. It's run by Kathy Emerson, who is a Canadian and now lives in Rwanda. She runs this fantastic program. It's northwest of Butare, and again, she's been instrumental in getting children in school, getting children off the streets. The children that she's working with, the families she's working with, are those who have been orphaned, and they're often children who are raising their own brothers and sisters. So these teddy bears, 100 bears, went to a kindergarten class. So the joy on their faces and the excitement when the bears arrived was pretty heartwarming. So we were very pleased again to be able to, because of the generosity in our own community, to share that with people in Rwanda.
Another donation that you got from the community was, of course, you take a lot of money over with you, and you can convert that to buy supplies. And one thing you did, again, was to support the hospital, right?
Absolutely. The hospital is in desperate need of basic comfort care items, and that's the focus of a partnership in caring. We want to be able to provide comfort care. So this year, we were able to provide the social work department with money to buy basic food supplies and personal care supplies. And the other thing we focused on this year was bed linens. Last year we had bought 100 mattresses, and this year we decided that what was needed were bed linens. So we were able to buy those in Rwanda, supporting their community there, and providing sheets to the hospital. Also, the money that's raised here in our local community goes to support the Helping Babies Breathe program. There are some costs associated with that, some training costs. So we were able to provide money for that, and also the education around the palliative care. We were able to send one French-speaking nurse at CHUB in Butare off to Cameroon for a 5-week course on palliative care training. So that was really significant. Between that piece and the piece where we went to Uganda and brought back the information about the Hospice Uganda Africa program to CHUB, was instrumental in them identifying their palliative care team and getting organized and hopefully moving forward with their palliative care initiative.
One other place we haven't talked about that you did visit outside of the hospital was an orphanage. Tell me a bit about this one.
It's my favorite place to visit. It's Adar Orphanage. It's an orphanage for youth and young adults. The youngest child is about 5, and the oldest is now 25. I have a very fond connection to this orphanage. Visited there last year, and it came back again this year. And they're a group of women who take care of 27 orphans. And some of the orphans are from the genocide in 1994, and others are children whose parents have died since then. There's 27 children. 14 of those are epileptic, and there's very little medication or care provided to those children. So medical care, they're certainly cared for very well at the orphanage. They're all matched up with special skills that they're able to do. There's some basket making. There's some of them work taking care of the rabbits and the chickens, and some take care of some of the kitchen duties or bed making duties. But for me, it's a pretty amazing place. There's one young boy in particular. His name is Jared. He's 10 years old, who has found a real place in my heart. And it's a really sad story about how he came to be at the orphanage, and how caring the people are there for him, and how much he's progressed in the 3 months he's been there. The orphanage is like I say, there's 4 women who live there all the time. And they have next to nothing, very little clothing. They just have the very basics of things, but they have such love and care for these group of individuals. It's really amazing to watch and see, and I love spending time there.
You also had the opportunity to be in Rwanda during the observances they have, marking the anniversary of the genocide that happened there, and you went to several observances. What were those like?
Genocide Memorial Week starts on April the 7th, and there are activities for one week, and essentially the country shuts down, and it's a very solemn time. Each day there are prayer services and services of testimonials of people who have lived through the genocide, and it's really it does invoke a tremendous amount of anxiety and fear, and brings back obviously some very difficult memories for many of the people of Rwanda. We were invited to take part in a ceremony in one of the remote villages outside of Butare. It was a 3-hour ceremony. And basically, it's filled with prayer and song and a real sense of forgiveness within the community, and quite a healing experience. Although it's filled with lots of emotion. Each community is expected to have these testimonials and these I wouldn't call it a celebration. It's not a celebration, but a way to remember, what's happened to them, and in many ways, it's a way to move forward from their experiences of the genocide. The particular ceremony that I went to, Kim Grant from the nurse from Halifax, and Janelle McKay, who's a local musician, there were probably over 500 people there, both men and women. The local Anglican church brought their choir. Now, there's no electricity there, but they were able to find a generator and set up the music, and there were some microphones and some singing, and in fact, Janelle was able to join the choir in one of their beautiful songs. It's a very, very moving experience. We were welcomed there with open arms. In fact, what we heard from the people after the ceremony, and even during the ceremony, is that they were so grateful that we were there because it provides them added support. And it was quite a moving experience for all of us.
Now, over and above a partnership in caring that was at CHUB, also there were some fourth-year nursing students from St. FX that was also at the same hospital, right? That's
right. This is their 5th year, I believe, of traveling to Butare, and that's in fact how our partnership began, was through the efforts of Elsa Jensen, and then her communication with Lynn McDonald at Gasha. So the nursing students, 10 very independent and experienced nurses, came and spent the 4 weeks in Rwanda with their 2 nursing instructors, Elsa Jensen and Liz Farrell. They were working and partnered up with nurses in different units throughout the hospital, and I think they would say that their experience was quite rewarding, and certainly they would have learned a lot, experiences that they'll carry with them for the rest of their working lives.
When you look back at what happened over the course, some were there for a couple of weeks, some were there for 3 weeks, some were there for 4 weeks, like yourself. When you look back now, you've had a chance to begin to process what you did there, what you observed there. How would you rate the trip? Was it what you hoped it would be?
Oh, it was more than we hoped it would be. Especially for myself, I wasn't where there wasn't. I'm a mental health nurse. Where there wasn't a lot of focus on a mental health piece, although mental health is part of palliative care, it's part of neonatal care, it's part of medical surgical care, obviously. There wasn't a real focus for me, so I was able to take on more of a coordination role, which I really quite enjoyed, and I learned a lot during this time as well, especially from the palliative care team and from the neonatal nurses as well. As a group, I would say that we far surpassed our expectations for this year, and we were busier than we were last year. Or in fact, last year we were trying to find our way. This year we hit the ground running, and we were very busy, and we could have used more time, in fact, to finish up some of the projects that we were working on.
So, plans already underway for next year?
Yes, we are. We're already planning to get a team back there next year. We're looking at doing a major fundraiser in October. We've had many requests from our community to speak about our travels to Rwanda. So we're busy doing that, and reporting on how the trip went, and reporting back to the people who are so generously support us in our community. We're looking at doing a video as well, which is something we did last year and we found very helpful in explaining the trip. So we're looking at having that done hopefully by the end of June. You'll see us at the farmers market. We'll be there in June and August and September. And you'll see us around. Hopefully we'll do some more talking about the program and our plans for next year at the library, which is something we did last year. We found that was quite successful. So we've been quite busy since we've been back, surprisingly busy since we've been back, already preparing for next year. We have things to finish up, communications to finish up with the director of the hospital at CHUB, and thinking about what can we do next year. And we also have a long list of people who want to volunteer, so we need to match up their skills with the needs of the hospital. So we're busy.